Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967342256 and subscribe our channel for the best OET videos and feel free to contact us on 76967342256 for the best OET coaching. And there we start. I'm just going to start this role play without wasting any time. So this is one of the speakings I really wanted to discuss because there are certain words in this speaking and this speaking is little haywire because we prepare for a lot of speakings which are comparatively easy. But this speaking was little different. All the OET speaking, all the OET writings will always be easy. At the end of this video, please reach up to the end of this video as I'm going to put an old topic of Suzanne Matthews, which would be very important letter to be seen if you are having exam on coming Saturday. So it is very important to see that letter because that kind of a letter came, prior to this exam that happened last time. So you can say last to last exam. So this time we are expecting that this same type of exam can come because the letters have been little tricky. So I will attach that video at the end. But yes, I wanted to have a speaking role play as well, which is little different. So first of all, there are certain basic things I would like to tell about OET speaking. OET speaking, the person who takes your OET speaking is interlocutor. He is not an examiner. He does not have any marks or she does not have any marks. So she or he is just a patient. So please be very confident when you are talking to your patient, to your examiner, treat him as patient. So you say, good morning, my name is Bhupesh, I am a nurse, how may I help you? So behave like a nurse. This is very important because this will give confidence in your voice. And at last, everything you do in the speaking will be recorded in the audio form. So when everything has come, is going to be assessed by the examiner in Melbourne in the audio form, that means your voice should be very sure. So I'm talking in Hindi, the same thing. आपकी रिकॉर्डिंग जो होती है ऑडियो रिकॉर्डिंग वो मेल बन जाती है। आप कैसा, आपका जो एग्जामिनर सामने बैठा है वो एग्जामिनर नहीं है, वो सिर्फ एक पेशेंट है, उसके हाथ में कोई मार्क्स नहीं है। उससे ये पूछने का कोई फायदा नहीं है कि मेरा पेपर कैसा हुआ, हाउ वाज माय एग्जाम। सो दीज थिंग्स विल नॉट मीन एनीथिंग क्योंकि उस एग्जामिनर के हाथ में कोई मार्क्स नहीं है। सो यू हैव टू बी वेरी कॉन्फिडेंट इन योर सेल्फ and your voice should be excellent. The most important thing when it comes to OET speaking is fluency. How confident, how fluent you speak. So always develop that confidence that you speak for at least 5 minutes continuously. There would be two role plays, 3 minutes for the preparation, 5 minutes to speak. So 3 minutes, 5 minutes to speak, another role play. 3 minutes to prepare, 5 minutes to speak. So overall, your speaking task would be around 20 minutes. The person who is conducting is just a patient. He is not an examiner. So these are the two important points. And at the end, it is very important to summarize the task. There are many people who get 340 in speaking. The major reason behind this is fluency. Second is not taking is thinking that examiner can give you marks, so that does not give you confidence. And the most important thing, why do most of the people get 340 marks if they fail? Otherwise, you pass easily in OET speaking. But I'm saying the people who lose at 330, 340, that means they are not summarizing the task. Means at the end of the task, you need to summarize the task. It is very important. So your tone and summarizing the task plays a very important role if you want to score heavily in OET speaking. If you want to score 460, this voice is very important. So the role play is different, that it is a rural community health clinic. So rural means village. So there is a community health clinic in the village. A patient has come to see you today because their regular doctor is on holidays and the locum is fully booked for the next few days. So that means there is a regular doctor who comes to your community center normally, but somehow he is absent, he is on holidays. So on the place of that doctor, some other doctor, locum means some temporary doctor, some temporary arrangement, तो एक डॉक्टर वहां पे नहीं है, so some other doctor is there for the next few days. So they are presenting with the symptoms suspicious of hepatitis A, but you are a nurse. So the patient has come to you with symptoms of hepatitis A, including the mild fever, tiredness, nausea, vomiting, and jaundice. So first of all, as a nurse, you need to ask the patient about the symptoms. So how would you say? You will say, could you please let me know about your symptoms? So that is how simple you can, could you please tell me about your symptoms? So that the patient will say, I'm having mild fever, I'm having tiredness, nausea, vomiting, and jaundice. Then you will explain, okay, then how do you say, let me explain you. After listening to your symptoms, you are suspected with hepatitis A, and you need to just replace this word with you, and you will need blood test including liver function test to confirm the diagnosis. So you are suspected with hepatitis A and you will need blood test. That is how simple OET speaking is. Just read the same lines. Could you please tell me about your symptoms? Okay, after listening to you, I feel that you are having uh, hepatitis A, and you will need some blood test, including the liver function test, to confirm your diagnosis. So then you recommend the patient that patient contact his regular GP's receptionist. So now patient will say, what to do now, nurse? So the original doctor, the regular doctor is not there. So you are giving an advice that you should contact your regular GP's receptionist and explain the situation to her and request her to fit you in the routine of locum ASAP. ASAP means as soon as possible. So when one doctor is not available, so आप दूसरे doctor को दिखा रहे हो. You can go to other doctor meanwhile. So for that you need to get your appointment fixed with the help of your receptionist. So the receptionist will fix your appointment with the locum. So that is what this point means. So this point can make you confused in exam. So इस point का ये मतलब है, this point means that you can take the appointment from your regular GP's receptionist and explain the situation and request her. If you do not understand, don't change it, and request her that you should be fitted in to see the locum ASAP. So you speak the same lines when you are confused. So then you let me explain you about hepatitis A is a virus and it can spread through contaminated food and water, eating utensils, poor hygiene practices. So there can be various reasons. It is more common in developing countries than Australia, but these days it is spreading in our kind of our area as well. So we are concerned. People with hepatitis A are considered to be infectious for a week after the onset of the jaundice. Explain that usual duration of illness about 1 month to fully recover. So it will take 1 month for you to recover. So as a nurse, you are supposed to pass on this information, and this task is very different from the normal task. That's why I'm considering this task as one of a very good sample of OET role plays. So now I will teach you how to speak on this topic for 5 minutes. The timer that shows me is 12 minutes 30 seconds. So I have to speak up to 17 minutes 30 seconds. So let me explain you how will you do in actual OET exam. So you will say, good morning. My name is Bhupesh. I am a nurse here at at community health clinic. So how may I help you? Then patient will say, see nurse, I am here today to see you because I am having some problem. Could you please explain me about your problem and about the symptoms that you are having? Yes, nurse, I'm having many symptoms. Could you please tell me in detail what symptoms are you having? Well, nurse, I'm having mild fever, tiredness, nausea, vomiting, and jaundice. Then you say, okay, let me tell you that these days, what we are observing that there are many patients who are coming with hepatitis A, and you are also suspected with hepatitis A. So to confirm it, you will need blood test, including the liver function test to confirm the diagnosis. So is it fine that you need to undergo the test? So are you willing to undergo the test? Yes, nurse, if you think it is important, I really am willing. Okay, that's great. So I will fix your appointment with these things. And also I will recommend you that you should contact your regular GP's receptionist and explain her the kind of symptoms you are having and that you are suspected with hepatitis A. And you should also request her that you should be fitted in to see the locum ASAP. Means you are repeating exactly the same lines. Please listen to this carefully. I will do it again. Good morning. My name is Bhupesh. I am a nurse. at over here, or you can say I'm a nurse at this community health clinic, so how may I help you? Then patient will tell about the symptoms. So you will say, okay, I have got your symptoms, and after listening to you, it seems that you are suspected with hepatitis A, and you will need blood test including the liver function test to confirm the diagnosis. So is it okay if I fix your appointment for the liver function test? Yes, nurse, please do that. Okay, that's fine. I will certainly fix your appointment. And also, I would like to recommend you that you should contact your regular GP's receptionist and explain about your situation, that you are having hepatitis A and that you need to undergo liver function test to confirm the diagnosis, because you are having symptoms like mild fever, tiredness, nausea, vomiting, and jaundice. Yes, nurse. Okay, I will do that. I will talk to the receptionist. But nurse, what is hepatitis A? Is it like a very serious condition? Well, please don't worry that hepatitis A is a virus. Yes, it is something really important to be addressed, that you cannot ignore it, but and it can spread through various means like contaminated food and water. It can also spread through eating utensils. It can be due to poor hygiene practices. So there can be multiple factors which can lead to conditions like hepatitis A and spreading of virus. And also, I would like to tell you that it is more common in developing countries than in Australia. So there is nothing much to worry. But yes, in the recent days, it is spreading in Australia as well. So you need to be cautious. And I would like to again recommend you that liver function test is very important to confirm the diagnosis, the appointment of which I have already booked. So is everything okay? Have you understood everything? Yes, nurse, I have understood everything. Okay, should I explain you anything again that you have not understood? No, nurse, I have understood everything. Okay, and also I would like to tell you some precautions, because when somebody is having hepatitis A, they are considered to be infectious for a week. That means you can also spread on the virus to other people if you are having hepatitis A. As for now, it is suspected. So I would really encourage you to kind of isolate yourself from the community, so that you do not spread virus to others till the time your test result is declared. And also, it is very, very spreadable or contagious, especially after in 1 week after the onset of jaundice. So you have to be very careful. So आपको information इस तरीके से देनी है. You have to give the information like this, that it is very important to isolate yourself for the time being till the time your results will be out. And once the result is out, if you are infectious, you need to isolate yourself for at least a week, so that you do not spread the virus to others. Are you getting my point? Yes, nurse, I am getting your point. Okay, and I would also like to tell you, usual duration of this illness is about 1 month to fully recover. You don't have to get scared that it will take 1 month. I am talking about the complete recovery. After a week or two, you will start feeling much better. But for the complete recovery and for the re-energizing of your body, it might take a month. So are you all good with the information? Yes, nurse, it's all right. Okay, then I'm fixing your appointment with the liver for the liver function test, and also would like to remind you again that it is very important to contact your GP's receptionist to fit you in the locum as ASAP as soon as possible. Is it all right? Okay. And again, I would like to tell you that there is nothing to worry, because hepatitis A is a kind, this line is very important. There is nothing to worry, as hepatitis A virus is otherwise contagious, but this can surely be cured with good medications and treatment, and doctor will recommend you those medications. And also, please try to get your appointment with the locum as soon as possible. Is it all good? Okay, then take care. So these are the instructions that you need to follow. Please follow these things to cover your 5 minutes. And you should, now the time in the clock is 8:28 or 18:28. So I have spoken for more than 5 minutes. So you have to, I related this point again with this point, that it is very important to do this thing. You will be infectious for a week. So please undergo this test. It is very important. So that is how you cover the time. So covering the time is very important in OET. You should cover around 4 minutes and 50 seconds, or maybe 5 minutes. And once your time is about to get over, examiner will pass on a gesture that it is time to summarize. So as soon as examiner passes on the gesture, even if you are at this point, you say, okay, and last thing I would like to tell you that it will take normally 1 month to recover, and there is nothing to worry. I have already fixed your appointment for the test, and also you should try to get an appointment with the locum, and there is nothing to worry. So take care of yourself. So you end up the task quickly in a nice way. So that is how it is important to cover the time. But covering less than 4 minutes 30 seconds is dangerous. So by chance, if your timer, if you think that your time is not over, then examiner will give you a gesture to carry on. Then you again say, I hope you have understood all the points. I would like to repeat the key points, that you might be having hepatitis A, and to confirm it, it is very important to undergo liver function test, and also it is very important to get the appointment from your GP's receptionist, and please avoid meeting any close one, at least for the time your test results are not declared. So I hope you have understood everything. Now you take care of yourself. So in this way, you can cover those 30 seconds when examiner tells you to carry on. So you can repeat the whole task. So it is a very good thing to do. And otherwise, if you are behind, then examiner will say it is not over. So you need to सम द टास्क वेरी क्विकली. तो आपको बड़ी जल्दी से खत्म करना है टास्क को. और अगर 4 मिनट 30 सेकेंड्स हुए हैं, तो उसको दोबारा से रिपीट करना है टास्क को. सो दैट इज हाउ यू विल मैनेज द टाइम इन ओईटी स्पीकिंग. देयर इज नथिंग टू गेट वरी. एग्जामिनर विल हेल्प यू फॉर श्योर. And also, the only thing I would like to add on in this task is it would have been a very good thing if you would have asked for the name of the patient. So how could you have done that? Good morning. My name is Bhupesh. I am a nurse at this community health clinic. So first of all, I would like to ask your name. My name is John. Okay, Mr. John, before I can help you, I need to ask you that what has brought you here? What are you facing any problem? Yes, nurse, I am having many symptoms like mild fever. Could you please explain your symptoms in detail? Then he will explain the symptoms. Okay, Mr. John, after listening to your symptoms, I feel it seems that you are a case of hepatitis A. And to confirm this diagnosis, it is important to undergo tests like liver function test. So again, I will like to highlight the key points. Asking the name, first thing. Second, covering the time well, explaining the points well. Third, in the last, summarizing the task is very important because some people get stuck at 340. So this is the major reason that you are not summarizing the task. Sometimes you are not asking the name. Asking the name is not important in every task because if the patient is already in the hospital, then you cannot ask the name, but you can confirm the name. So you can say, good morning. My name is Bhupesh. I am a nurse in this hospital and today I will be attending you. But before attending you, I would like to confirm your name. Is your name Mr. John? So that is how you will do if you are in the hospital setting. So these are the very important points in the OET speaking that will help you to pass. If you are around 330, 340 marks, this particular speaking session will help you to score more than 370 or 380 if you practice it precisely. And always stay connected to the examiner. Take help of this cue card. Like I took the help, like speaking about these lines, I would like to recommend you that you should contact your regular GP's receptionist and explain the situation to her that you are having these symptoms and also request her to be fitted in to see the locum ASAP. So you speak the same words so as to avoid any kind of fluency break. So in OET, you can speak the same lines and can explain it again that I mean that you should get the appointment. So these are the very important things about OET speaking, which can definitely help you to score more than even 360, 370, 380 and will keep you safe. So please follow all these important things to score higher and higher. This is Dr. Bhupesh from Dr. BKM Institutes. And now I will attach, please see the thumbnail now, because I am attaching the writing, which would be very helpful in the Saturday test. If there would be referred back case or a discharge back case, then this writing of Suzanne Matthews and the sample paper will definitely help you. Even for the doctors, it is a very important sample paper to follow for the writing. Thank you very much. Take care. Have a good day. Thank you.